It's no secret there are health disparities between black and white people in our country. And today we want to dig a bit deeper into this topic and hopefully shed some light on some of the specific illnesses and diseases. Let's welcome in Dr. Jasmine Marcellin from Nebraska Medicine. Thanks for taking the time out here today. Let's start with the basics. Which diseases do we see the biggest disparities between black and white people?
There are significantly more people from African American communities being diagnosed with HIV. Almost 50% of new diagnoses are coming from the Black community. When we think about things like cancers, for example, Black men are more likely to have be diagnosed with prostate cancer and also more likely to die from prostate cancer than white men. And when we think about breast cancer, in women, there are data from the CDC that show that Black women are more likely to be diagnosed with more aggressive or further more serious types of breast cancers and more likely to die from breast cancer than the white women counterparts.
Certainly alarming data. Do we know why these differences are happening? And maybe more importantly, what can we do with the information?
Because of structural racism, Black individuals were not afforded the same type of health care, not afforded the opportunities to access care in hospitals. One might think, well, this was something that was happening a long time ago and this is not happening now. But the reality is there are still inequities in access to care, access to primary care, and that means preventive services, access to medications that people can take to help to prevent them from being infected with HIV, for example. When you think about the preventive services like vaccinations, mammograms, and other cancer prevention, there are significant barriers that people may have to accessing healthcare at an equitable rate. Therefore, if they don't have access to the screenings and the preventions, then the diseases themselves are more likely to be showing up. This is not something that is a result of any kind of biologic difference, because race is not a biologic factor. Race is a socio-political factor.
And no doubt there's a lot of work that needs to be done to narrow the gap in disparities here. Dr. Marcellin, thank you for taking some time today and shedding some light on this important topic.
Thank you for having me.
And there are several local people and organizations doing their part to narrow the disparity gap. Pastor Portia Cavett has advocated for equitable COVID vaccine distribution. The Noah Clinic, along with Charles Drew and One World Help, provide more equitable health care choices as well. One last piece of advice from Nebraska Medicine: be on the lookout for local health fairs. Our thanks again to Dr. Jasmine Marcellin.